Welcoming a new life into the world is an incredible journey, and I know one of the biggest decisions expectant parents face is how that journey unfolds, specifically the choice between a normal vaginal delivery and a cesarean section or C-section. Let's break down what you need to know so you feel empowered and informed about both options. Starting with normal vaginal delivery, this is the natural route and it's been the standard for centuries. One of the biggest advantages is recovery. Usually, you're up and on your feet much faster, with a shorter hospital stay and a quicker return to your daily life. The risks of major complications like infections or significant blood loss are typically lower than with surgery. Babies born vaginally also get exposed to helpful bacteria in the birth canal, which can give their immune system a nice head start and help their gut health. Plus, that squeeze through the birth canal helps clear fluid from their lungs, lowering the chances of breathing problems. Immediate skin-to-skin and breastfeeding often happen within moments, which can be amazing for bonding and getting breastfeeding off to a smooth start. And if you're hoping for more kids in the future, vaginal deliveries usually have less impact on those plans. Of course, there are some challenges to keep in mind. Labor is unpredictable. Sometimes it's quick, sometimes it's long, and it can be physically demanding. Pain is a big factor, and you might need pain relief during the process. There's also the possibility of vaginal tearing or an episiotomy, which can lead to discomfort and, in rare cases, longer-term issues. Occasionally, things don't go as planned, and an emergency C-section might be needed if the baby is in distress or labor isn't progressing. Now let's talk about cesarean sections. This is a surgical procedure where your baby is delivered through an incision in your abdomen and uterus. With a planned C-section, everything is scheduled, so there's less unpredictability, and you completely skip the pain of labor and any risk of vaginal tearing. For high-risk pregnancies or certain complications, a C-section can be the safer choice for both you and your baby. And in emergencies, it can be life-saving. That said, C-sections are still major surgery, which means there are surgical risks, infections, bleeding, and reactions to anesthesia. Recovery takes longer. You'll likely spend more time in the hospital and need extra help at home. There's also a higher risk of scar tissue forming, which can cause issues down the line, and future pregnancies may carry more risks, like placenta accreta or uterine rupture. Babies born by C-section may have a slightly higher risk of breathing problems at birth, and sometimes there's a short delay in holding or breastfeeding your baby because of your recovery. So, how do you choose? The best option depends on your medical history, your pregnancy's specifics, your preferences, and most importantly, your doctor or midwife's advice. There's no one-size-fits-all answer, and your healthcare team is there to help you make the decision that's safest and healthiest for you and your baby. I hope this comparison has helped clear things up. If you found this helpful, please like, share, and hit subscribe for more honest, evidence-based info about pregnancy and parenthood. Thanks for watching and wishing you a safe, beautiful birth experience.